Hi, good evening, everyone. Welcome to the Equal Hope segment on CAN TV. My name is Leilani Lacson-Soltysiak, and I'm the Data and Communications Coordinator at CAN TV at Equal Hope. Thank you again for joining us tonight. Equal Hope is a nonprofit organization whose mission is to eliminate health disparities in Illinois. We do this by offering free services such as free cervical cancer screenings, mammograms, assisting with getting vaccines such as the HPV vaccine, COVID vaccine, and flu shot. And by the way, it's not too late to get your COVID and flu shot. We link people to medical homes for free. So if you don't have a primary care provider you can go to, if you're starting to feel sick or if you need to see a doctor, we can help you with that. And we offer many other services. You can find out more about us on equalhope.org or give us a call at 312-942-3368 to learn more. We also have social media. We have Facebook, Twitter, Instagram, and TikTok. Also wanted to mention that if you're a cancer patient, caregiver, or provider, we have cancer support resources on equalhope.org. Let me introduce this month's guest, Dr. Tochi Okwuosa. She's an associate professor of medicine and cardiology and director of the cardio-oncology program at Rush University Medical Center. She is also the founding chair of the Chicago Cardio-Oncology Consortium. Dr. Tochi, thank you for joining us this month.
Thank you, Leila. It's a pleasure joining you.
So Dr. Tochi was on our radio show this past summer, so she is familiar with Equal Hope. So February is American Heart Month, and today we will be talking about how to keep our heart healthy and happy. So as I said, February is American Heart Month, a time when all people can focus on their cardiovascular health. President Lyndon B. Johnson, among the millions of people in the country who had had heart attacks, issued a proclamation in 1964. Since then, U.S. presidents have annually declared February as American Heart Month. Cardiovascular disease and deaths from cardiovascular disease are increasing in working age adults, and Black adults are among those bearing the highest burden of cardiovascular disease and the health-related consequences, particularly in the U.S. Black adults, also in the U.S., die from heart disease at a rate 2 times higher than white adults. Taking time to care for your heart can be challenging as you go about your daily life. So let's get started. Dr. Tochi, tell us about yourself and how you got involved in the medical field.
Hi, Leila. Like you already mentioned, I'm Dr. Tochi Okwuosa. I'm a cardiologist at Rush. And how did I get involved in the medical field? I somehow knew I definitely wanted to go into science because I was good in science in school. And my mom always decided I was going to be a physician, but I rebelled like any other teenager out there, and that wasn't what I was going to do. But then I was really stuck on computers. I loved coding and the rest of them. And I took an internship doing computer coding and finally decided it was a lonely job. I wanted to be with people. I wanted to work with people. I wanted to take care of people, most importantly. And then I went and shadowed physicians and decided this was what I wanted to do. So I was glad I decided to go into medicine myself, not just because my mother asked me to do it. And I have to say that I've never, ever regretted it. It's been the best decision of my life. I feel like this is my calling, and I thoroughly enjoy seeing and taking care of patients. I particularly enjoy cardiology because to me, it's a very logical field, like A plus B equals C. And so I really enjoy being a cardiologist, and I love taking care of my patients.
Great. So your specialty is quite interesting, and that's one of the reasons why I contacted you about a radio show this past summer. So tell us, what types of patients do you treat?
I'm what we call an oncocardiologist, or in the field of cardio-oncology, which is heart disease in cancer patients. And so my focus is patients with cancer who have heart disease, either anticipated heart disease as a result of the cancer treatment they're going to be receiving, or if they develop heart disease while they're undergoing cancer treatment, or maybe the treatment that they received have long-term consequences on their heart through maybe the rest of their lives as cancer survivors. Those sorts of people are the people I take care of, and from a cardiovascular standpoint.
Okay. So What
And
are,
I just have to mention that my field is particularly relevant because, as we all know, heart disease and cancer are the number one and number two causes of death in the United States. And so they're typically competing. They have common risk factors to a certain extent. And so they're usually linked one way or the other. So that is the reason why my field is a very potent and important field in the field of oncology.
how long has this field been around?
It's a very short-lived, it's a very young field in cardiovascular diseases. I would say that some people have been first terminology of cardio-oncology was mentioned sometime in the mid to late 1990s, but it's only in the last, I would say, 10 years that it's kind of started to gain traction in cardiology as more and more cancer treatments are being discovered and more cancer treatments are being used to prolong life in patients. We're beginning to realize more that cardiac disease is becoming an issue in that population. And so it's begun to gain traction, I would say, in about the last 10 years. And it's only in about the last 5 years that we've begun to have organized societies that are particularly focused on cardiovascular diseases and cancer.
Okay. It sounds like an interesting field.
Very, very, very interesting and very fun. I think it's a very rewarding field. As we all know, a good number of cancer patients are very sick. And so you can imagine a sick cancer patient who then ends up having heart disease on top of that, or a cancer patient who has successfully undergone treatment and then they have heart disease that ends up causing huge amount of morbidity or problems for them, or even maybe kills them as a result. Because we know in cancer patients, apart from second malignancy or second cancer or new cancer, the main number one cause of problems or health issues and death in that population is heart disease. And so you can imagine somebody having gone through all the rigors of cancer treatment who then ends up having heart disease that kills them or causes big problems for them. So our role is really to manage their heart disease so that they can safely go through cancer treatment and end up with very minimal cardiovascular consequences eventually after treatment is ended. So it's a very rewarding field, especially given how sick the population is. And it's a field that actually brings you really close to the patients.
Oh, that sounds really great. What are heart disease and cardiovascular disease?
So the difference between the two is what you're asking. Heart disease means a disease of the heart. So we're talking about this organ that keeps going lub dub in the middle of the chest, right? So that's heart disease. When we're talking about cardiovascular disease, we're talking about that heart that's going lub dub and all the channels that are connected to it, right? So the vascular system, because the heart itself, in order to pump blood, has to have blood coming back towards it, and then it pumps that blood out. And that blood coming back towards the heart that is then being pumped out is really a circuit, right? The arteries and the veins are the things that bring back blood and take out blood, or rather the other way around. The veins bring back blood and the arteries take out blood to the rest of the body. And so that whole conduit and that whole circuit is part of what constitutes cardiovascular disease. So when we talk about heart disease, we talk about things like heart failure and coronary artery disease and heart attacks and heart valve disease and so on, that sort of thing. When we include it under the wide umbrella of cardiovascular disease, then we include diseases like hypertension or high blood pressure and strokes and so on. So it's a broad, or aneurysms. Those are all broader categories of cardiovascular disease.
Okay. Yeah, when I was doing my research for this show, I was a little confused, like when I was writing up the script, do I say heart disease or cardiovascular disease?
Yeah, I mean, both of them work. But again, heart disease is a narrower field. You're just saying heart disease, but cardiovascular disease is all encompassing.
Everything. Okay.
And the heart doesn't exist in isolation. So for us, from a heart standpoint, we prefer to think about it as cardiovascular diseases. For example, in my board certification, I'm called a cardiologist, but I am board certified in cardiovascular diseases. So that's how most of us cardiologists are board certified.
Okay, that makes sense. So what are some of the symptoms of cardiovascular disease?
So some of the symptoms, I think chest pain is one thing that everybody knows about and can relate to. So usually we say crushing chest pain. That's usually right around the middle of the chest, sometimes towards the left area. They can go up your jaw, down your arm, to your back, that sort of thing. But, I really want to encourage people to think about other things also that could be signs of heart disease. Shortness of breath is another big one, right? Usually shortness of breath when you exert yourself. Or sometimes shortness of breath, like say in the middle of the night, the person wakes up and they're gasping for air. or they, maybe they used to sleep with one pillow and now they're sleeping with 2 or 3 pillows. That sort of shortness of breath usually means that there may be fluid in the lungs. And so that's also part of one of the symptoms that we think about when we think about heart disease. Another symptom is leg swelling. So leg swelling could be a general thing. It could just be that the person has lymphedema, maybe they have varicose veins, that sort of thing, and they tend to pull a fluid in the legs. But if you have leg swelling that you never used to have from before and it's new, that's concerning because it could mean a sign of heart disease. It could also be a sign of kidney disease or liver disease, but heart disease is one of the main things that we think about when we think about people that have leg swelling. Other things are dizziness. Some medications can cause dizziness and may not be such a big deal, or people get dizzy as they get older too. But sometimes heart rhythm problems can come with dizziness. And then some of the, like I already mentioned, some of the heart medications can drop the blood pressure or cause low blood pressure, which can then lead to dizziness. So dizziness is one of the things that we also think about. Palpitations, where people feel their heart racing or skipping beats, that could mean arrhythmia or an abnormal rhythm of the heart that could portend some either minor heart rhythm issue or something that's more serious in terms of heart rhythm consequences. Other things that we think about are if somebody has poor circulation, they could have pains in their legs when they walk, and it could just be pains in their calves as they walk, or pains in like their hip area, their thighs, their calves as they walk, that usually goes away or gets better as the person is resting. So these are some of the things that we usually would think about. And of course, if you faint, that most likely somebody that faints also may need to be assessed by a cardiologist. Those are the typical things that we tend to think about. And then one particular symptom of heart disease that most people don't tend to think about, that I think is important to think about, is feeling tired. If you're fatigued out of the ordinary, like you just completely pooped, that could be some of the first signs of heart disease. People that have heart failure could feel pooped or feel really tired like that, or people that have blockage of the heart arteries. And even sometimes feeling like that could actually be a sign of a heart attack. And then another one is sometimes GI symptoms, like if somebody feels nausea and even sometimes vomiting can be a sign of a heart attack or an impending heart attack. So there are a few things that we need to think about when we're thinking about symptoms of heart disease that may need to be sorted out by a doctor. The general idea is if you feel out of the ordinary, worse than usual, and you're not feeling well for whatever reason, better to be safe than sorry, better to get evaluated and to say, oh, this is just indigestion, it's gonna go away.
Yeah, I was going to have a follow-up question and ask, like, when should someone see a doctor? Like, what is normal, what is not normal?
Yeah, so like I mentioned, these symptoms are not normal usually and would need to be evaluated. Always better to be safe. When should you see a doctor is when you have symptoms that are out of the ordinary, that are not, especially if those symptoms come in, they're lasting beyond the day and they're getting worse and not getting better, or even if they just last a few minutes, but you see that the symptoms are escalating and not getting better, but they're getting worse, then I think it usually makes sense to get evaluated. You can either, depending on how bad it is, go to the emergency room or go to an urgent care facility close to you, if you have one close to you, or if you have a physician that's very responsive, you can definitely contact them and try to talk through it with them.
So how is heart disease diagnosed and treated?
So heart disease can be diagnosed in different ways, depending on the kind of heart disease that we're thinking about. One of the basic tests that we get when people come in, whether they're coming into the emergency room or they're coming into a cardiology clinic, is an EKG. So what we call an electrocardiogram. And that is, that sort of where they put these sticky tabs on your chest and on your legs. And then we get something that we get a rollout that looks like a graph paper. That's called an EKG. And that gives us a sense of the rhythm, the heart rhythm of the person. And if the person is having a heart attack, we can usually also tell on the EKG as well. So that's one of the basic tests, very, very inexpensive, very, very inexpensive test, and very simple to do. Most doctors do it in their offices. Then another major test that we get in heart patients that have established heart disease or that we're concerned that it could be having heart disease is an echo, a heart ultrasound. And that's the test where you're usually lying down and we put some gel or sticky stuff on your chest. And then we use a probe and take pictures of it, like an ultrasound, like an ultrasound that people get to look at babies, that sort of thing. But we use it to look at the heart. Usually it's a test that lasts about 45 minutes to an hour long. And we get lots of information with this. We look at the heart valves, we look at the heart function, how the heart is squeezing, whether it's normal or abnormal. We look at whether there's fluid around the heart. We look at the right side of the heart, the left side of the heart. We get a lot of information using an echocardiogram. So those are usually the two basic tests for the most part. And then other tests that we get, like a stress test to see if we need to look for blockages of the heart arteries, a coronary angiogram or cardiac catheterization that actually visualizes the heart arteries to look for blockage, an MRI of the heart or cardiac MRI, cardiac CT scan. All of these other more specialized tests that we get depending on the conditions and what we see on the EKG and the echocardiogram.
And how's heart disease typically treated?
So there are many different ways to treat heart disease, depending on the heart disease that the patient has, right? So if we're thinking about things like blood pressure, then we would usually start medications like beta blockers or ACE inhibitors or calcium channel blockers and so on and so forth. There are many different blood pressure medications that we could use out there. Then other things that we could do if the patient has coronary artery disease or blockage of their heart arteries, then they may end up receiving a stent for that blockage, depending on how significant that blockage is. And then they may end up with a statin. Statins are cholesterol medications that, even though they control cholesterol, also independent of the cholesterol control, reduce the risk of heart attacks and strokes. And so oftentimes, most people that have blockages of their heart arteries will end up receiving a cholesterol medication, again, to reduce future risks of heart attacks and strokes in those patients. And then if they do get a stent, they may end up getting a medication called Plavix or Brilinta, that sort of thing, or ticagrelor or clopidogrel. Those types of medications are sometimes medications that we use in people that have heart artery blockages. And then if they have heart failure, there are 4 major classes of drugs that we tend to use if they have heart failure, depending on the kind of heart failure that they have. But the one that we think about usually when we use these drugs are the heart failure where we're concerned about the squeeze function of the heart. If it's reduced or the ejection fraction is low, then we would use beta blockers like carvedilol or metoprolol. We use ACE inhibitors like lisinopril or enalapril, or what we call ARBs, like losartan or valsartan. And then we use spironolactone, which is a diuretic or a water pill, but it's good for heart failure. And then we could also, more recently, we're now beginning to use this diabetes medicine. It's called they're called a class of drugs called SGLT2 inhibitors. I'm sure some of our patients have heard of them, like empagliflozin, also known as Jardiance, or dapagliflozin, also known as, I'm blanking on the trade name for dapagliflozin, but those two medications, Farxiga, that's the name for dapagliflozin, those two medications we can sometimes use. Again, 4 classes of drugs that we can sometimes use for patients with heart failure. So the way we treat the heart disease depends on what the patient is having, what we're concerned about with the patient. So if the patient is having chronic chest pains, we may choose to start them on medications called nitrates, or calcium channel blockers, depending on the kind of, or what we think is causing those chest pains for those patients. So what we use, what we pick, or the way we treat the patient with heart disease depends on what we're treating and how we want to treat it.
Okay. So what is typically the prognosis for people, or prognosis or health outcomes for people who have heart disease?
Prognosis for people who have heart disease depends on how they're managed or how they're treated and how they're diagnosed, how quickly they're diagnosed. So for example, 10 years ago, 15 years ago, we would always say that people that have heart failure have 50% mortality. In other words, within a few years, within 5 years, half of them are dead. But nowadays, that's not the case anymore. A lot of people that have heart failure live for years and years and years on end, as long as they put on the correct type of medication. This is part of the reason why when people are concerned about heart disease, or when people have symptoms, it's good for them to go and get checked out, to go and get evaluated. Because in the end, those medications that we put the patients on are life-saving. Those medications that we put the patients on prolong the lives of these patients. And it's not really just about giving medications to prolong the lives of patients. We also have to think about prevention, right? So there were some studies that were done in the 1990s and early 2000s that showed that, yes, these days we have medications to treat heart disease and we have stents that we put in these patients, but that actually the main things that prolong lives in patients with heart disease is prevention. It's the preventive processes that we go through that actually are the things that make a difference, right? So when we think about prevention, we think about a patient, think about talking to patients about diet. We think about talking to them about exercising, and we think about talking to them about quitting smoking, about control of diabetes, about control of cholesterol, about control of blood pressure, and more, and then other risk factors, obesity, losing weight, right? More recently, the American Heart Association has also added sleep to the picture. So people getting 6 to 8 hours of sleep per night is particularly important. So it's important to think about all these risk factors and have the patient and have our patients be very religious about trying to be very careful about making sure that these risk factors are controlled. And I usually tell my patients, know your numbers, know your blood pressure, know whether you have diabetes or not, and what the normal numbers are, know your cholesterol levels, know what normal numbers are. And you can use these parameters to empower yourselves as patients, or empower us as patients, to then be able to make sure that we're managing our health. Patients should be advocate for themselves or advocate for their family members, because in the end, we as physicians, we're human, right? So physicians sometimes make mistakes, and sometimes physicians miss things. Sometimes physicians are just too busy because there's a lot that's placed on us, on our shoulders as physicians. And so patients need to be their own advocates. And if they're not sure, if a patient is not sure about something, ask your doctor. We are obliged to answer your questions. And we're also obliged to make sure we explain whatever is going on with you very well. So be your own advocate, ask questions, and be sure to take charge of your own health as a patient. That's the best way to prevent and to prolong life.
So we have less than 4 minutes left. So let's start wrapping up the conversation. Dr. Tochi, can you tell me what are some things that we can do today to help prevent heart disease?
So in terms of preventing heart disease, those were what I just talked about in terms of patients being empowered and knowing. So some of the things that we can do. So if you want it to be specific, exercise is one of the major things that we can do to prevent heart disease. Mm-hmm. I always say, sitting and, at home, working, whatever it is that we're doing, especially these days, everybody can do things virtually, like I am doing this interview virtually. It's important that we get up and realize that we need to exercise. American Heart Association recommends 150 minutes of moderate intensity exercise per week. Moderate intensity is like fast walking. And about 75 minutes of high intensity exercise, like running, jogging, or singles tennis. So it's important that we remember these numbers and be able to exercise. Then in terms of diet, making sure we're getting plenty of fruits and vegetables in our diet, and whole grains as well, and making sure that we're eating less of the junk food or fast foods that typically most of us love, but we know that these are things that we're supposed to eat that much less of. And then, like I said, taking medications and making sure that we are at a healthy weight, right? That usually normal BMI or body mass index, which takes your weight and your height into account, is usually between 18.5 and 25. So trying to maintain that healthy weight is particularly important. And if we're obese, trying to kind of scale our certain parts of our diet back so that we can get back on the good side of the curve for weight maintenance will be particularly important. So these are, and then of course, getting a good night's rest. And again, knowing your numbers and controlling diabetes and cholesterol and high blood pressure to levels that are normal. So these are all some of the things that we all could do to take charge of our health and to prevent future risks of heart disease.
Those are all really great, helpful steps and things that we certainly can start doing today.
Absolutely.
Well, that's all the time that we have today for our Equal Hope segment. I'd like to give a big thank you to Dr. Tochi for joining us today. She gave us some really helpful tips so that we can all take care of our heart and keep it happy. So join us next time on Tuesday, March 28th from 5 to 5:25 p.m. That's when our next show is. We'll be talking about diet and nutrition, and our special guest is Dr. Veronica Johnson from Northwestern University. It should be a great show. I also wanted to mention really quickly, we have an upcoming event on March 18th. You can find details about it on equalhope.org under our events section. It's a free event. It's going to be a really great event. Space is limited, so register today. I'd like to thank all of you for watching the Equal Hope segment on CAN TV. Thank you and have a good night.
Thank you for having me.
Thank
Bye,
you.
everyone.
Bye.
Bye.